Good afternoon. I'm John Ayanian, Director of the Institute for Healthcare Policy and Innovation, and I want to welcome faculty and staff and others from our IHPI community joining our town hall community conversation today. This is an opportunity to bring our members together, a very difficult time for many of us with professional and personal commitments and the stresses of the coronavirus epidemic. If we move to the next slide, I especially want to start by thanking all the members of our community who are working on the front lines of healthcare, delivering care to individuals with COVID-19 as well as other major health conditions. And I also want to thank the members of our research community, faculty, staff, and students, many of whom are taking on new and important challenges to address this pandemic that we're all living within and try to understand how we can emerge with a better healthcare system and with better healthcare outcomes for the patients and communities that we serve. Next slide. Just to remind you of our email address, ihpifeedback@umich.edu, where you can send us feedback about this town hall or other future town halls that you would encourage us to host, as well as other ideas you have for how IHPI can meet the needs of our research community, our academic community, and the broader world that we serve, especially during this time of the COVID-19 pandemic. So if we move to the next slide, I'd like to highlight some of the resources and opportunities available to IHPI members. And the first set of those opportunities is through our Data and Methods Hub. The Data and Methods Hub team, led by Patrick Brady, has been very active in recent weeks, pulling together a catalog of nearly 70 internal and external databases related to COVID-19 that are now described on the internal portion of our IHPI website, the members only portion. There's a link there on the right-hand side of this slide that you can use with your level 1 login to learn more about these data sets. Our Data and Methods Hub team is also available for consultations on how Michigan medicine data can be used to access information related to COVID-19 or other conditions that you're interested in studying. And if you have ideas for new data sets, the address is shown at the bottom of this slide, where you can write to ihpi-data@umich.edu to raise further suggestions of data sets that we could make available to our members, as well as questions that you might have for the Data and Methods Hub team to help you with your work. So if we move to the next slide, I wanted to highlight one example of how our members are coming together with some of our existing partners to develop new data resources that will, I think, illuminate much to be learned about the COVID-19 pandemic here in Michigan and elsewhere around the country and the world. That example is the My COVID-19 initiative, which has grown out of the Collaborative Quality Initiatives, or CQIs, that IHPI members lead in collaboration with Blue Cross Blue Shield of Michigan and hospitals around the state. A team led by Scott Flanders and Hallie Prescott has pulled together a new data registry resource from 26 Michigan hospitals to date, and that number may grow over time, where they will be collecting data from this cross-section of hospitals around the state on COVID-19 patients, who's being admitted, what their treatments are, and their outcomes. And so that's a resource that could be available to you as IHPI members. There's a data request access form shown at the link on the bottom of this slide. And if you're interested in learning more, I would encourage you to go to that link to learn about this new data initiative and how you might participate or bring your research ideas forward for consideration. I also want to highlight the work of MICHR, the Michigan Institute for Clinical and Health Research, which has developed a COVID-19 rapid response research registry to collect data on COVID-19 patients being treated within the Michigan medicine health system and bring that data together with data being collected as part of an international consortium. If you're interested in learning more about that registry, the website link is shown on this slide. This is an effort being co-led by Emily Summers, an IHPI member from the Division of Rheumatology, and Emily Martin, an IHPI faculty member in epidemiology at the School of Public Health. And I encourage you to check out that new resource. Another set of resources I would highlight for you is on the next slide. organized by our University of Michigan Office of Research, led by Rebecca Cunningham as the new Vice President for Research at the university. Over the past several weeks, the team in her office has pulled together a website focused on COVID-19, including frequently asked questions for researchers from across our campus, news about new studies coming out from the University of Michigan related to COVID-19. And I particularly highlight the two right-hand boxes framed in blue on this slide. One is the Research Index, which is a compendium of nearly 200 studies that have been launched in the past month by University of Michigan faculty members. There's a link shown below that box, michiganmed.org, where you can complete a short survey and post any research that you're doing related to COVID-19. So it will be visible within the university and to others interested in finding out about research being conducted here on campus related to COVID-19. And then finally, the right-hand blue box includes information about funding opportunities, both federal and non-federal funding sources outside the university, as well as some internal funding resources for COVID-19 related research. So I encourage you to tap into this website on the University of Michigan Office of Research website to learn more about all these sources of information. And then on the next slide, I want to highlight and thank those of you who completed a survey that we circulated in recent weeks to all of our IHPI members, trying to learn about either ongoing work or interests that our members have to come together with colleagues from across the Institute and develop new research projects, new interdisciplinary research projects. And we've, from the responses to date, have pulled together 9 research interest groups focused on COVID-19 in each of the different domains shown on this slide. These groups range in size from about 5 to 25 members and are still open for additional IHPI members to express interest in participating. We encourage you to sign up by tomorrow, April 24th, because after that, our IHPI staff will start helping these groups to begin organizing and moving forward and conducting virtual meetings, and we hope in the not too distant future some in-person meetings as our remote working restrictions begin to loosen up. But we'd like to get this work started soon, and we have a number of members who are ready to lead and participate in these different domains. And if you see a domain that fits your research interests or a research idea that you have, please go to the website shown at the top of this slide, express your interest, and if there's a group not shown here that you believe would be worthwhile to organize and launch, you can send that to us through ihpifeedback@umich.edu as an email. Next slide. I want to highlight some of the opportunities for policy impact and how our policy engagement team, led by Eileen Kostanecki and Sarah Wang, is working to support your efforts and connect them with policymakers. Eileen continues to interact regularly with other University of Michigan government relations staff, as well as with policy stakeholders, to guide our IHPI response to COVID-19, both in terms of new research activities, as well as bringing the expertise of our members forward to work with governmental and non-governmental organizations that would benefit from that expertise that our members have that could be shared during this pandemic. I also would encourage you to share your policy relevant work with our policy engagement team and our external relations team, as well as to look for an announcement in the coming weeks about policy sprint funding from within IHPI to support COVID-19 related research, and particularly projects that are particularly timely and policy relevant that you may be interested in moving forward. So stay tuned for more information about that opportunity. Next slide. Our communications team continues to disseminate and publicize the important work that you're doing. The team can assist with engagement with reporters and other aspects of media relations, raising the visibility of your work on social media, helping you to prepare op-eds and commentaries that you'd like to publish more widely, as well as assisting you with graphic design, including infographics and visual abstracts. I would highlight that we have a new COVID-19 focused webpage on the IHPI website that features the work and news about our members related to the pandemic. And then we begin distributing every 2 weeks a COVID-19 email update with news and new research and policy engagement of our members, and as well as funding opportunities. So I encourage you to watch both the new news update that we're circulating by email, as well as the COVID-19 focused webpage. Next slide. And then our education and training program continues to move forward in virtual format. Our R01 bootcamp and KMOC study sections continue and are important resources for our members. In June, we'll be starting a new transition to our workshop, which is fully subscribed with approximately 25 IHPI members signed up for that, which would prepare people to then in the future join the R01 bootcamp and prepare their first R01 submission. We're excited about continuing our summer student programs, our internship and fellowship funding, as well as our Lunch and Learn series and skill building sessions that will be conducted virtually for students working with IHPI faculty members this summer. You can learn more about these programs at the Education and Training webpage on the IHPI website. And lastly, I would highlight new mentor coffee hours that we'll be launching in May as part of our education and training programs. And look for an announcement of those coffee hours coming soon. I'll be hosting one of them myself, and look forward to other senior colleagues within the IHPI community hosting mentor coffee hours for early career faculty across the campus. Next slide. So I want to conclude once again by thanking all of you, whether you're on the clinical front lines or the research front lines of COVID-19, for all that you're doing. We know this is a very stressful time with the concern about social distancing and staying safe and healthy and with our families, as well as meeting the needs of our communities. So we thank you for that work, and we're here to support it. And I would now turn back to Kara with a reminder about how you can submit your questions and comments through our chat function. And I think I'll turn it back to Kara to kick off the discussion and question and answer period.
John, are there things that occurred to you while you were speaking that you might want to highlight further while we wait for questions?
Sure. Well, you know, this is a first town hall and community conversation that we're hosting. We would appreciate your feedback either during this session or afterward, both on whether you found this useful and whether a general discussion like this would be useful again in the coming weeks, as well as if you would like us to convene sessions like this on specific topics where we would bring in expert speakers from within our own community or outside the community to share insights on how we're managing with this pandemic in the various aspects of our work and professional lives.
Great, and I think we're going to have a poll through Zoom very shortly through my colleague Stacy. We do have a question, and that's about the policy aspect of things. And what are we hearing from policymakers about what they're needing? A great question. What kind of information, what kind of research do they want to see happen? So John, if you want to answer that, and I believe we also have staff on board so that they could be added to the discussion.
Sure. Well, you know, I'll give an example. For the past month, I've been serving on a task force that was developed from the governor's office when it first became clear we were going to have a surge and a critical demand for hospital services in the state, particularly in southeastern Michigan. The governor's team formed 3 work groups on people focused on workforce needs, on supplies, and on hospitals as places of care, and it brought together a cross-section of people within the state government as well as outside the state government to develop recommendations and protocols for how to meet that surge from a state perspective. So it's been very interesting for me to participate in the governor's task force on COVID-19 workforce planning and think about how we bring in volunteers to the state, how we contract with professional staffing services, and then how we work with the military and FEMA and public health service with some of the staffing resources they have to support the field hospitals, one of which has already opened in downtown Detroit at the TCF Center, and another one which is opening in Novi at Shopper Showcase within the next week. We had actually had an active team here, including a number of IHPI members, planning for a field hospital on the athletic campus at the University of Michigan if it was needed. Luckily, it seems like with all the social distancing and efforts that people have been following in the state, we've gotten past the peak of the surge, at least the initial surge, and it looks like a field hospital won't be needed anytime soon here in Ann Arbor, and the demand for field hospital services in Detroit and Novi look like they'll be manageable. But that's one example of how the state government, and I know some of our colleagues are also working at the federal level as well. I might turn to our colleague Eileen Kostanecki, our Director of Policy Engagement and External Relations, to see if she has anything to add from what she's hearing from within our government relations team at the university, as well as outside policymakers.
Hi, John, and hi, everybody. I think that our policymakers are just desperate for any kind of information at this point, but what I would say is from a policy perspective, with our groups of people, disparities is obviously a huge topic at this point. And so we do have a couple of people from U of M that are on the state work groups for that. But modeling of all types of courses of interest, infection rates and social distancing models. When to open up society is a big question too for everybody. And employers are obviously very interested in that. Schools are interested in that. Just broadly across the society. Symptoms are obviously of concern, and all kinds of clinical aspects. The Blue Cross Blue Shield of Michigan partnership will shed a lot of light on a lot of that information. And the economics of all of this is also of great interest to our policymakers. Sorry, I'm losing my voice here, but I'm not sick at this point.
Thank you, Eileen.
Thanks, Eileen.
Kara, other questions or comments from our community?
Yep. We have questions about how the university's overall need to reduce expenses is going to affect IHPI and research at U of M more broadly.
That's an important question, and I think we'll all need to follow as this evolves going forward. I think everyone in our community received an email from Mark Schlissel that went out to the whole university, and a follow-up email from Marshall Runge that went out to the Michigan medicine community, talking about some of the steps the university is taking. Those steps that are being applied across the university apply to IHPI as well. So issues like cutting back on discretionary spending, hosting and entertaining expenses, travel expenses, if they're not externally funded. All of those are on hold right now. So, I think we're going to be watching closely. All the budgets for the coming academic year are under close review across the university. And we will certainly do our part to tighten our belts, but at the same time, try to support the key programs and services that we offer to IHPI members so that you can remain productive through this period of challenges that we're all dealing with.
Thanks, John. We've got a couple questions about the COVID-specific data sources and also COVID-related data in our usual data sources. I've unmuted Patrick Brady and allowed him to share his video if you'd like, and maybe the two of you could address some of what is available now or what we expect to be available from our usual data sources.
Thanks, Karen. I turn to you, Patrick, because I know you and the Data and Methods Hub team have put substantial work into developing that resource from communication with our members, and I appreciate you highlighting any aspects of it that you think would be useful to share.
Yeah, thanks, John. So I think in terms of the administrative claims that we being the Data Methods Hub primarily maintain, I think we'll see a big wave of use of that type of data around this time next year, because those data sets are a little bit behind some of the other data sets. But as you look through the listing of data on the sheet that I think Kara has provided a link to in the chat box, you'll see quite a few more up-to-date databases. So one of which, I think, John, you mentioned the MyCovid abstraction data.
Yes.
So you'll see links to things like the MyCovid data, which is an abstraction from multiple hospitals' EMR systems, looking at patients diagnosed with COVID-19. There is also multiple survey data resources included as well. So quite a selection of databases that are up to date. And if you, like John was saying, if you see something that's missing or something that needs an update, please email us at ihpi-data@umich.edu. We're always looking to add more, make it the most complete resource that we can. So any input is much appreciated.
And
Thanks,
also I'll
Patrick.
mention, since I'm involved in the National Poll on Healthy Aging, and maybe we can get Trish Meyer on, is that the National Poll on Healthy Aging also has data available to our members to use. And we have new polling going out soon.
Yes, I just said the data is available through ICPSR, and we're going to be adding a new wave of data, I believe, next week, and then subsequently continuing to add data from previous polls. So that is also available to our members and more
And
broadly
our
as
next
well.
fielding for the poll, Trish, which will be our first post-COVID fielding, is when?
We will be fielding in June. That is our plan right now.
Great. And John, actually, it's been suggested that we also might think about having an additional town hall specifically on the types of data available and drilling down further into that. So that might be a topic for a future town hall.
That's a good suggestion, and I think we could also welcome the data analysts who work and research project managers or other staff that faculty would like to include in a discussion of those databases.
And Patrick, you're not out of the woods yet. We had a question from somebody who's wondering about ambulatory data, especially related to telemedicine. Nope. There you go.
There you go. Can you hear me, Kara?
Yes.
So the question was about telemedicine data.
Actually, ambulatory data in general at the state level, because we talked about the hospital level data, but if there's any ambulatory data.
Yeah, that's a good question. I'll have to dig around a little bit more. I don't have a solid answer for you off the top of my head, but I will. I'll make a note to dig into that after we are done with the call.
Kara, I thought I saw Chad Elamoodle logging into the town hall. You might just unmute Chad to see if he would add anything about some of the work on telehealth and the new strategic initiative that we've launched in recent months that turns out to be incredibly timely as data do become available on telehealth services.
Yeah, so there obviously a lot of excitement around telehealth as a way to keep patients at home. There is, in terms of data that's out there, unfortunately we can't. It's a little early to be able to look at a number of different research questions using administrative claims because those claims aren't available quite yet. We are looking at some questions if anyone's interested using Blue Cross data through the Michigan Value Collaborative, specifically looking at some of the questions in telehealth. That data is starting to come in, and so it's a single payer in a single state, but there are things that we can look at if there's some interest there. At the health system level, there is data that's available. The numbers or the overall adoption of video visits, e-visits at the health system has been quite incredible. We were averaging about 400 video visits per month for the last couple, the months right before the pandemic, and then in April, this first part of this month, we've had about 17,000. So a lot of data there. I think some of the ideas that were brought up about disparities, those are very topical right now. So feel free to reach out to myself or Emma if there's any specific data requests for telehealth related data. And then I know that Lori is also going to be leading the work group for telehealth research as well. So I think there's a lot of resources here for that.
And while you're on, we've had another question about resources for how providers can do high quality telehealth, especially in primary care. Are there resources that you're developing or that are being developed elsewhere that we could point our members to, and or research opportunities for that?
That specific question in kind of like the, I don't know. I don't know of a resource for that. The American Medical Association does have some information. The Alliance for Connected Care has some information. Those could be resources for that specific question. But if anyone's willing to, start to put together some of that information, that would be great. We can help disseminate it.
Thanks, Karen. Maybe we can take that question offline and look to, with IHPI faculty and staff, pull together some key resources if that's of interest.
Excellent. We have a general question of how can IHPI members have the most impact right now?
Well, I'll give my personal perspective, and I'd welcome anybody who wants to raise their hand. I noticed in the participant list you can raise your hand and share your thoughts on that. You know, I think it's continuing to work and address the needs that we're passionate about. You know, I think one of the strengths of our IHPI community is people bring a lot of passion to their work, whether it's their research, their teaching, or their clinical work and their policy engagement. And we try to support our members in those dimensions, and particularly in the research and policy engagement. I think our skills and opportunities to contribute are needed as much or more so than ever. Some of that will be directly related to COVID-19. Some of that will be making sure that the problems that we were all working hard on before the pandemic, such as mental health issues, social isolation, health disparities, a whole range of clinical quality questions. How do we finance our healthcare system? Those are all going to be every bit as important, if not more so, given the severe economic times that we've entered, as well as the very challenging issues around public health and healthcare delivery that we're facing as a society, both in the U.S. and globally. So I think it's really thinking hard about how we can make our work as relevant as possible. And the areas where we have expertise that may be adaptable to addressing questions of COVID-19, or maybe just as important to continue working on those issues with renewed energy that we were all tackling before the pandemic struck. So, that's my personal perspective. And if there's anyone else on the town hall discussion today that would like to chime in with theirs, I'd welcome your thoughts.
I think I'm going to unmute Dr. Gould if she'd be so kind. She posted a nice comment, and I think she can be more eloquent about it than I can.
Yeah, I just sent a comment just to Kara, but really for everybody. One of the things I'm hearing from people in both research and public health arenas is that this is potentially an incredibly opportune time to focus on health equity, health equity, health equity. So it's been very clear that pre-existing health disparities are being exacerbated by the pandemic. But it's also very clear that health of others, that everybody's health is interrelated, okay? So that, your health affects mine. And that folks who are not as well off and are more at risk both for infection and from infection, then that has implications for everybody. So I personally think that this is potentially, and challenges always come with opportunities, right? So this is a potential opportunity to make sure that this doesn't go away even after a vaccine is developed.
Thanks, Susan. Those, I think, are very important insights. I think many of the colleagues on the Zoom session today know you well, but for those who don't, maybe you could just give a brief introduction of your positions within the university and particularly within IHPI. And I would highlight that you're leading the new Health Equity and Ethics interest group, one of the 9 that I highlighted earlier in the discussion, and there's more information that will be available about that through the IHPI communications team.
Yeah, I am professor of internal medicine and health management and policy, and I have often straddled this line between ethics and health policy, and that's really where you find issues related to equity. I direct the Health Policy Path of Excellence for medical students. I'm also in the Community Engagement Core of MISHAR, and as John said, I'm leading this Ethics and Equity Research Interest Group for IHPI. And one of the things I'm trying to do with that basically is just make sure that we take advantage of all the expertise and we don't duplicate each other, but instead try to work together and accomplish as much as we can in the area in particular of health equity research. So, anything else I need to say, John?
No, thanks, Susan. That was
Okay.
a good introduction. And I might just ask for all of our faculty and staff in the discussion today, if you'd like to add any of your thoughts about how we as a IHPI community or the University of Michigan are responding to COVID-19 or other aspects of our work, please raise your hand in on the participant list, and Kara or I can call on you to share your thoughts.
Great. And I've added one more link in the chat, John, which is a link to the ever-growing list of COVID-related research funding opportunities that the Vice President for Research's office has posted and keeps updating. And I think this idea that funding agencies, foundations, and others are seeking to fund work at this time. And maybe you could talk about what you're hearing on that front.
Yes, I think I would reiterate, Kara, what you just said, that that's a robust list of funding opportunities from some of our traditional funders like NIH institutes and the Agency for Healthcare Research and Quality, as well as foundations and a couple sources for internal funding through M.Diabetes and MIDAS, the data science initiative on campus. That I would encourage you to look at if you have specific ideas that may be relevant to one of those funding sources.
We don't have any raised hands, and I think we've handled all the questions that have come in. And I think we're almost out of time anyway. But I think everyone will need to look for an email from us, and please, invite colleagues who missed the session to watch it on the recording when we have that available, because it's something that I hope will be useful to many people.
Great. Well, thank you, Kara. Thank you to the IHPI team that organized this town hall community conversation. And thank you to all of you who joined us today. Please send us your thoughts to ihpifeedback@umich.edu. If you have ideas coming out of this conversation that you'd like to share, and make use of all the resources that we discussed in today's town hall, if they're relevant to you, and if there are other ways that we can support your work, please reach out to me or to any of our staff so that we can move your ideas forward and support you in the best ways possible. So, Kara, I think if we don't have any other questions or raised hands, we can.
I think we have one reminder that the IHPI member newsletter will be going out shortly in the next few days, and it will also have all of these links in it. So many ways to get at these resources.
Great, thank you. And stay tuned for other ways to engage with IHPI while we're all working remotely, especially the new interest groups. If any of those 9 topics are of interest to you, or you have another one that you'd like to propose, please let us know. And once again, we hope you and your families and your networks of friends and colleagues all remain healthy and well. And there's our poll results. This looks like we have it by acclamation that we could hold future town halls and make them useful to you. So thank you for participating today, and we look forward to staying connected and helping you to stay connected with colleagues across campus.